Cyle Cavett is an extremely active 41-year-old man who had slowed to a shuffle because his hip was giving him a lot of trouble. In his search for assistance, he ultimately decided on cellular therapy at Sanford Orthopedics and Sports Medicine in Fargo. Since then, he has returned to living a life he feared he had left behind for good.
Before I had the injection done, I didn't know if I ever would get to the point again where I wouldn't be in pain all the time.
Cavett had conversations with several providers about his hip, but most suggested a total replacement. He didn't want to give up his activities, though, nor did he want to be the guy in his 40s who was walking around with a new hip. At the same time, he knew he needed to do something.
I was in a lot of pain. I would have to strategically map out how I would actually go into a grocery store. I would know that, okay, I can only go down so many aisles before the pain is going to get so bad that I can't walk anymore and I'll have to sit down.
Orthobiologics is an area of medical care that uses regenerative cells to treat diseased and damaged tissues. Most commonly, this type of treatment is used to treat osteoarthritis, but it can also help with tendon and ligament injuries.
Basically what we're doing is harness the body's own healing abilities, making sure that it kind of brings in good inflammation in order to help heal some of the things. It's never going to regrow cartilage, it's never going to reverse arthritis or anything like that, but it can help with the pain and symptoms of those issues.
Cavett's problem is with osteoarthritis, a condition where the cartilage in the joints declines over time, creating a bone-on-bone condition. His treatment involved taking bone marrow from the back of his pelvis. Those cells were then separated in a centrifuge to produce a concentration of regenerative cells. With help from an ultrasound to locate the exact affected area, the cells were then injected back into Cavett's hip.
The hope was to have the injection either slow the progression, help with a little healing, just give him some fluidity back in his joint and improve his function and decrease his pain.
Being young, I also was advised that if I had a hip replacement now, I would probably be looking at 2 or 3 more in my lifetime, which didn't excite me at all either.
Sanford's regenerative efforts are safe, FDA compliant, and utilize the latest research techniques. Caregivers do not guarantee patients that cell therapy will provide complete relief. Instead, they present it as an alternative that has helped many patients.
We need to make sure that we are letting patients know that if this does help, it may not last forever, and that it may be a couple of years, but if those years mean putting off that surgery and they're in a better spot in order to do that, then that's great. And some people may get a lifetime of benefit from it.
Count Cavett among those who is definitely in a better spot. Because of his therapy, next summer is now looking more exciting than it once did for his family.
When I was little, my parents would take us to Colorado and we'd go out and hike. Well, that was one of my fears. I'm in my early 40s. Am I going to be able to go and hike with my little kids? I didn't think that was going to be a possibility. Now I'm not worried about that happening at all. I know it's going to happen.
For Mick Gary, I'm Jason Anschutz, Sanford Health News.